Welcome to Window on Well Street, a program that shares information about delayed food sensitivities. Sensitivities that may cause symptoms like headaches, irritable bowel syndrome, fatigue, stress, even ADD or ADHD, just to mention a few. I'm Robert Chesney, your host, and in today's program we're going to be discussing the immunobloodprint. This is a simple blood test that identifies foods which could be the cause of many symptoms. And we're so happy to have with us today from her practice in Fresno, California, Dr. Mikel Parsons. Dr. Parsons, so good of you to join us.
Thank you for having me.
It's common knowledge that one of the fastest growing issues for children is autism. Now, these statistics are staggering. It's just rising at such a rapid rate. Share with us your bird's eye vision of children's autism today, would you, Doctor?
That is such a huge spectrum of varying degrees of manifestation with that. But one of the common denominators that needs to be addressed is the foods. You know, we eat multiple times a day, and we want to make sure for that child that we're feeding them foods that are not going to be harmful to them on a cellular level. These kids already are having a disconnect, so to speak, with their brain and how the brain communicates from one side to the other, and they often have intestinal problems along with that. So it's even more important that you know ahead of time what foods are going to provide that child's physiology every opportunity to work as wonderfully as we can get it. So sensitivities are a huge part of that puzzle.
Anyone that's professional and successful in their practice like you are, Dr. Parsons, has clearly picked up a sixth sense, so that almost the minute you see a child that's at risk, you may sense there's a food sensitivity. Was there ever an issue of food sensitivity that surprised you? Could you share a case study with us?
Actually, yes. I was working with an 18-month-old, and they were having some significant health issues. And, you know, we're all familiar with, you know, dairy being an allergy, eggs, the whole gluten thing. But sometimes we forget that any food can be negative in someone's physiology. And for this particular little one of the worst responses to a food I've ever seen was when this little one ate turkey. Turkey! Turkey, for heaven's sakes. And the response was amazing as soon as we eliminated turkey from the diet. Now, of course, prior to them coming to see me, the whole family had switched over to more of a turkey poultry-based diet because they thought it was a healthier choice. This particular child actually did better with beef. There you go. We would have never figured that out had we not done testing.
How were you able to counsel the parents, Dr. Parsons, to substitute certain foods? From what I've learned about your work, you really are a proponent of not depriving children, but substituting foods.
Absolutely. You know, there's this mindset that we humans get when we're told no or we can't do something, that's what we want to do. Or if we're told don't touch that, what are we doing? We're wanting to touch it. Same thing applies with food. If we're pulling things out of the diet, we don't want to just be deprived all the time. That's a negative thing. So oftentimes before we pull things out, we want to make sure what can we put back in, or what things can we introduce that maybe you've never tried before. When we do that, first of all, with children in particular, we don't want them to be dropping weight unless there is a weight issue. And for little kids, oftentimes when we're making dietary changes, we have the whole texture issue, new taste, those things are challenging. So adding things in sometimes before removing the offending foods is going to set that child up for an easier transition. And then you're going to be able to not worry about, are they getting, you know, problems with their weight, are they losing muscle mass, some of those negative effects that we don't ever want to see in a child.
You mentioned this child with the turkey sensitivity. Would you elaborate a little bit on this? Obviously, you don't have to share anything personal, but what we'd love to learn is how the recovery process works. Was it instantaneous, or did the changes occur over a long period of time?
With that particular little one, it was within a few days. It was amazing. And I have to tell you, as a practitioner, I was a little skeptical that their whole problem set could be from turkey. So that was a huge learning experience for me, and I have since opened up my mind, and I fully understand now you don't know. You really don't know until you test, and then you get them off of those foods and then reintroduce. Very, very important.
Well, thank you for joining us, Dr. Parsons, and we're going to continue with Window on Wells Street after the break, but I want to encourage those of you watching who may have a family member, a friend, or a coworker who's experiencing similar health issues. Please forward the link of this video to them. They'll be so happy. And if you haven't had your immunoblood yourself, please learn about it and get yourself tested. I did. Believe me, it's made monumental changes in my health. Remember, there's a hidden link between what you eat and how you feel. I'm Robert Chesney, and we'll be right back with more Window on Wells Street.